Hello everyone. We got a lot of interest from a previous video showing how the 3-act slide can be used to begin introducing multi-directional or valgus knee force into the lower extremity as a means of improving deceleration of an important but potentially dangerous knee position. As you can see by these pictures, clearly the knee is required to endure quite a bit of valgus type force during athletics. I wanted to just show a few different strategies we're using to introduce this post-op ACL patient to safe multi-directional knee loads using his body positioning as the driving force while working on the 3-act slide. In this first clip, you can see how his right leg is sliding back to the stability block. We've got the angled portion of the stability block for him to press his right forefoot up against to get some extra stability. You can see how much frontal plane pelvic motion he gets. He's getting a lot of pelvic side bending, really getting some good hip adduction as to the means to create that valgus knee stress. So he does a nice job of sort of creating, frontal plane and transverse plane loading to that left hip and butt to really put him in a pretty secure position to handle the knee valgus positioning. In this next clip, he uses his right leg going to the same stability block, but we've changed the positioning of the block to use the vertical wall. A little extra stability for him as he goes into a pretty vulnerable position as he opens up his hips. So he's able to utilize less proximal lower extremity, less of his glute to decelerate that force, yet still a position that a lot of athletes and people in general are going to have to get into. So once again, a little different means of creating that valgus knee stress for him to control. This next clip, he uses his right leg moving towards a right, kind of posterior lateral stability block. Once again, he creates that opening up of his hips a little pelvic rotation. So the direction of his right leg kind of drives that valgus stress into his left knee. And again, we're just looking for that quality of motion, the control, the deceleration capability, but the stability block helps give him a little extra help and stability as we introduce it. This last clip shows more of a posterior slide. Again, we're using the angled portion of the stability block so he can secure his forefoot to get a little extra stability. He gets a little chance to kind of get a hold position as he gets into that depth of bend. What's cool about this type of exercise, again, his left foot is off to the left side of the block, and his right foot goes towards the right side of the other block. But we can little by little ask his right foot to go more towards the middle of the stability block behind him, and then little by little move across. Same thing with his foot positioning on the front leg. If he started his front leg towards the other end of the block, as that right foot came posterior, depending on where I had him reach, he could get that much more valgus stress put into that left leg as he showed the capability of being able to control it. Just wanted to show, again, those few examples of how we're utilizing the 3-act slide to introduce valgus knee stress into this post-op knee patient. Same strategies obviously can be an important part of an effective training program, really trying to make sure that that knee gets sort of the full spectrum of movement opportunities that are going to be present as an athlete returns to play or just dealing with the sport of life. So hopefully you enjoyed that. Would love to get any discussion or thoughts that you have going. Thanks.